welcome healthy. Hope you are doing great. We are the Novel Health Community, wishes you a fit and fine tomorrow. Today we will be going to discuss a fungal infection named Aspergillosis. Watch till the end to know all about this dangerous disease. Aspergillosis is the most common invasive mold infection worldwide. It is one of the common post-COVID-19 fungal infection after mucormycosis, black fungus, and candidiasis, white fungus. About 10% of people with cystic fibrosis or asthma suffer an allergic reaction to Aspergillus. Aspergillosis is a spectrum of diseases that may be caused by a number of Aspergillus species. Aspergillus species are rapidly growing molds with branching septate hyphae and characteristic arrangement of conidia on the conidiophore. The most common infections in humans are A. fumigatus and A. flavus, but others, such as A. niger and A. terraeus, may be involved. The major portal of entry for Aspergillus spp is the respiratory tract. Inhalation of conidiospores can lead to several types of aspergillosis. In fact, it is almost impossible to avoid daily inhalation of Aspergillus spores. Symptoms of this opportunistic fungus affects our body in different ways, such as allergic bronchopulmonary aspergillosis. ABPA is a hypersensitivity reaction to the presence of Aspergillus in the bronchi. Here allergic reactions like coughing, wheezing, shortness of breaths occur. Pulmonary cystic fibrosis or asthma create more susceptibilities to this type of aspergillosis. ABP also causes general feelings of being unwell. Invasive aspergillosis occurs when the immune system is weakened by chemotherapy and AIDS. Aspergillus species invades lung tissues and cause infectious pneumonia which may be life-threatening. It can also spread to the skin, liver, bone, kidneys, brain. It often occurs in people with comorbidity. However, known symptoms of invasive aspergillosis are cough with blood, pain in the chest, shortness of breath, shock and fever. Aspergilloma, or fungus ball, consists of fungus, clots, and white blood cells in tubercular diseases. The main symptoms are cough with or without blood, and shortness of breath. Other significant symptoms are pain in chest and bones, vision difficulties, blood in urine, less urine, headaches, chills, difficulty breathing, skin sores, and bloody mucus. Diagnosis. In antigen skin test, little amount of Aspergillus antigen is injected into the skin. An allergic reaction is indicated by a tiny red bump. A sample of blood may be evaluated to verify if any antibodies that signal an allergic reaction are present. For invasive aspergillosis, biopsy test for lung required. Other important ways are chest X-ray, CT scan of lungs, sputum stain and culture to examine your bronchial mucus. Management and prevention. If it reaches to heart valves, or in case of aspergilloma, surgery is necessary. Symptomatic treatment will also help get better. People with weak immune systems, or mold allergies should avoid excessive amounts of dust or mold. Wearing a face mask, gloves, shoes, and cap can help us to fight with it. As in most infectious diseases, prevention is clearly preferable to treatment of an established aspergillosis infection. Diseases like uncontrolled diabetes, or any other immunosuppressive condition should be handled very carefully. Limit use of immunosuppressive drugs. We need to practice the proper moisture control and sterilization method for medical devices that we use very often. Apart from that, rigorous adherence to infection control precautions, and focusing on the sanitization of hospital and its content, can decrease such infections. The complications are Invasive aspergillosis can cause access, meningitis, sinusitis, seizures, carditis, liver failure, kidney failure, onychomycosis, otitis externa, cutaneous aspergillosis, ocular aspergillosis. In aspergilloma, hemoptysis is common complication. Recurrent APU episodes may cause atelectasis, widespread bronchiectasis and fibrosis. If invasive aspergillosis remains untreated, we may face sepsis and death. The risk factors of this infection are person with uncontrollable diabetes, patient suffering from AIDS, patient having chemotherapy for cancer treatment, immunosuppressive diseases, people have had immunosuppressive drugs and antibiotics for a long time, use of unhygienic devices handling. They are found wherever organic debris occurs, especially in soil, decomposing plant matter, household dust, building materials, some foods, and water. These filamentous fungi are omnipresent. Thanks again for watching this video. Please subscribe, like, and hit the notification bell. Stay tuned, stay healthy. See you in next video.